Okay, thank you for joining us today on March 25th for our press briefing for COVID-19. And we have some distinguished guests here with us today. We have Dr. Katz, Medical Director of the Scott County Health Department, Ed Rivers, Director of the Scott County Health Department, and we also have Nita Ludwig, Administrator of the Scott County Health Department. Rock Island County Health Department, I apologize. We are going to start out with some statements from Ed and Nita both, and then we'll hear from Dr. Katz. Ed.
Yes, in Scott County, we have 2 additional cases of COVID-19 to report. Both are middle-aged adults, 41 to 60 years of age. Both are currently hospitalized. And as we've been saying, we can continue to expect to see the number of confirmed cases increase in our community as testing becomes more readily available and the virus becomes more widespread in the community. We've talked about the measures you can take to help prevent the spread, and we must continue to act together to do what we can to minimize the spread in our community.
Go ahead, Nita.
Hi, this is Nita Ludwig. So in Rock Island County, we did have a confirmed case today, a confirmed positive case, a woman in her 40s, and she is isolating at home at this time. So this is our 3rd official case, and the other 2 were older and were hospitalized, and this one is slightly younger in her 40s. And so we would just like to point out that some people will have mild to moderate illness and will not need to be hospitalized or seek medical care, but could still isolate at home.
Okay, well, we'll now hear from Dr. Katz, Medical Director of the Scott County Health Department. Dr. Katz?
Well, I wanted to touch on 3 issues very briefly before I guess we're going to start questions after that. Not a whole lot new about the virus or the epidemiology of spread. Droplets and contact appear to be the overwhelmingly predominant mode. There is I believe it's the 4th published cluster of cases transmitted from somebody in the day or 2 before they got symptomatic. These all remain in family clusters so far. It doesn't appear to be a major issue, pre-symptomatic or asymptomatic transmission out in the community, but the data is immature, and so pay attention to that as it develops over the next several weeks. I've been looking very hard at responses in Asia, government and public health responses in Asia, to try and inform how it is I'm thinking about social distancing at this point. And when one looks at Korea, China, Hong Kong, and Singapore, where all 4 jurisdictions implemented very, very stringent social distancing, they managed in temporal association with those measures, flatten their curves, and it would appear to me that it's reasonable evidence that strict social distancing is probably an effective approach. Over the last couple of days in Italy, where last week and the week before they progressively strengthened their social distancing and lockdown, the last couple of days in Italy, the increases in the number of cases are less than they had been previously. So we may be seeing it in Italy as well. New York City also today and yesterday, increases in cases are lower than they had been with a series of relatively strict interventions, both at the city level and at the state level. So I'm quite confident that social distancing in all its dimensions is the right approach to take. And I think what you need to understand about that is it takes time to work. So we're in a position now where the appropriate response is to continue what we're doing, watch for any inflection upward in the number of cases, and at that point consider if there are more stringent things that we need to consider. And that's kind of where I am right now. I do have to say that as I've gone back and forth between my job at the Blood Center and my job at Scott County and looked around carefully, I think that Scott County residents are really paying attention to what we're saying and trying to maintain the appropriate social distance, all the things that means. So obviously, those of us doing public health want to thank the community for bearing the pain that we're inflicting.
Okay, so as previously, we would ask that you put your questions into the chat and we will go through some of these. We'll direct them to Nita, Ed, or Dr. Katz, so we'll get started here. Do we know, this is related to Genesis, is Genesis taking other cases from Illinois, and if so, how many? We might need a little more information on that before we're able to answer that, so if you could add a little bit more into the chat. The other part of the question is, how are the hospitals making sure they're keeping other parts of the building safe? We're hearing Genesis is closing off to parts of the hospital.
That's really a hospital-specific question that should be directed to them. We don't have a hospital representative here today.
Okay. I apologize, I missed one above. Can you confirm the total number of cases in both the counties again? Ed, for Scott County?
We have 3 cases in county residents, and the 2 cases that were tested in Scott County who were not county residents.
Nita, can you verify that for Rock Island County as well?
Sure. We have 3 total cases in Rock Island County.
Dr. Katz, this one is directed to you. Would you like to see Iowa Institute shelter in place at this point in time?
It's a topic that we're discussing at the county extensively. What would trigger advocating for even stricter measures? And essentially, as I said in my preparatory remarks, we're looking for any inflection in the curve of cases that we're seeing here. So if it looks like we're on an upward trend, I want to overreact, not underreact.
Another question here specifically for the health department regarding the closure of work on the new I-74 bridge. Is either health department assisting in the decision on how these workers should proceed? Nita, we can start with you on that.
Sure. I have not been contacted regarding workers on the bridge.
No, we learned about it the same way that you did in the newspaper.
Okay, thank you.
I don't believe those cases were in the Quad Cities, though, from my reading of the article.
We'd encourage you to keep posting the questions if you have some more. We have another one regarding some of the president's comments this week. Is the time frame around Easter reasonable or unreasonable date to expect life to begin returning to normal?
At this point, as I've looked very hard at the impact in the 4 Asian countries I mentioned, Italy, New York City, I think that we need to be very, very cautious about backing off at this point. Over the next several days to several weeks, we're going to have a much better ability to assess the impact of the various approaches to social distancing, and I think it's too soon to be making any decisions.
One additional question on here. This would be again for the health department. The I-74 workers who are infected may be out-of-town workers but are living and working here. Should the contractor be consulting a local health department?
As we've said all along, you're discussing the case with your medical provider is your first reaction. I don't know where these positive cases were or if they were in the Quad Cities, but anyone who believes they are ill should call their medical provider.
Thank you. Dr. Katz, this one is for you. How is the plea for blood donors going? How much blood does the Mississippi Valley Regional Blood Center have on hand? A couple of follow-up questions that I'll add in if that's not addressed in your response there.
Well, I have a conflict of interest here. I'm speaking for the health department at this point, and I would prefer not to get my two roles into conflict and suggest that you talk to Kirby Wynn at the blood center about that. I will tell you that as we expected at the blood center, the community is, in our entire region, which you may or may not know is 4 states, have done a spectacular job of maintaining the blood supply. And Kirby can fill you in on the details because it's a complicated story. The bottom line is we're really pleased that the blood supply is adequate at this time.
Hi, it's Kirby. I'm on. I don't know if you want me to jump in with any further comment, but I think that covers it well. Adequate at this time, and we know this will be a long event for us. We look for donors to schedule appointments. You know, if it can't be today, then next week, the week after, 3 weeks from now, and we have moved to a new policy of requiring appointments for blood donation rather than accepting walk-ins to help us control crowds. Well, crowds is a bit of an overstatement, but to manage donor flow would be a better way to put it. So I'll leave it there for now on the blood supply.
Another question popped up here in the chat. Based on what we've seen across the country and our other parts of the world, do you believe the Quad Cities has the necessary medical equipment and supplies to properly handle the coronavirus?
We have expertise, and we have ventilators, and we have hospital beds, but that all begs the question of whether we successfully flatten the curve, as we've been saying all along, to keep from overextending ourselves and not having enough. This is why the health department's focus is on encouraging all the social distancing and hygiene steps that we've been talking about all along. We don't want to have so many cases on any given day that the hospitals can't handle it. You have to ask the hospitals how many cases we can have before they're overwhelmed. We're not there yet.
We have an additional follow-up question on the bridge question earlier. The bridge workers did consult medical professionals, which resulted in the positive results. Given the number working on this project, are we simply having faith the contractor will keep everyone safe?
As I understand it, the project at this point is shut down.
Okay. We have a follow-up question here. Some people are upset about a perceived lack of transparency in regard to testing, the number of tests conducted, and the inability to draw conclusions about how serious or severe the outbreak may be. Would you please help them understand?
Well, first of all, we don't need more testing to know how serious it is. It's horrible. The problem with testing numbers is that the private labs do not provide us with information yet. I'm not sure if it'll be this way forever. We don't know how many tests are being done at private labs. Any numbers that I give you from the state hygienic lab are therefore not going to reflect what's going on. So we're using confirmed cases to track the epidemic, and we'll have to do so until we have more complete testing data, including from the private labs. I think the critical issues are that well people not insist on testing, that people for whom a positive test result will make no difference not insist on testing, because that then reduces the number of tests available for people with more serious illness. It is absolutely true that our testing capacity is not where we would like it to be, and we have to work around that reality here at the health department and in the healthcare system. I just don't think that the numbers of tests being done are terribly important, but worse, any numbers that I give you are really not going to be accurate, and I'd rather say nothing than be inaccurate.
We had just a comment that was added in there, but it looks like an additional question. Can you give us a logistical sense of why testing isn't more available? In other words, what explains why testing capacity isn't where we want it to be? Did you catch all? I can repeat. Can you give us a logical sense of why testing isn't more available? What explains why testing capacity isn't where we want it to be?
I think, as my one of my mentors, Dr. Tony Fauci, has said repeatedly over the last several weeks, decisions were made in the past that have dictated that we don't have capacity to test the way we would like to. Further, a lot of testing capacity in the U.S. has been diverted to places having more robust outbreaks than we have right now. Testing capacity is coming online, and I wish I had more. It would certainly be interesting data, but at the end of the day, following the shape of our curve of confirmed cases is going to give us the kind of information we need to make decisions and policy moving forward. I share everybody's dismay in the richest country in the world that we're having trouble rolling out testing. But it's getting better, and there'll be lots of tests 2 and 4 weeks from now. It's water under the bridge. I can't unmake decisions that were made earlier, and I don't know what else to say about it. And I guess the other thing that we haven't yet emphasized, this kind of similar, is we have also very limited supplies of personal protective equipment, and we need to find ways to get what we have to acute care settings where the concentration of infected patients is going to be highest and where our frontline healthcare workers will have the greatest risk of exposure. So we don't want people wasting masks and other barriers. I guess we make a plea to the media to get that message out.
Thank you. We'll give it one more minute for any additional questions.
You guys haven't seen what, oh, you have.
Okay, so thank you all for participating in this press briefing. We appreciate Dr. Katz's time, along with Ed and Nita, and your assistance in helping us to share these important messages with the community. We'll continue to be in contact with you about further press briefings as well as additional updates. Again, we expect to see additional cases in the community, and a lot of that information will be provided by both state health departments. So stay tuned for any additional information from us. Thank you.